Hello everybody, I am Dr. Srinivas, consultant neurologist from Renovo Hospital, Langarhouse. Today I am going to talk to you on low backache. This is the most common problem which most of the patients come across in their daily life. The low back pain is usually experienced by the patients in the low back area. This is more commonly seen in obese patients and in sedentary lifestyle patients nowadays who are on sitting on chairs for long hours without any movement to their spine, or when the posture is improper, the patients usually suffer from the low back pains. These patients, whenever they experience the low backache initially, that is localized to the lower spinal cord area and the backbone area where there is pricking type of pain or pinching type of pain, and after that they experience the radiating type of pain to the lower limbs in the low back pain. So the patient experiences neurological claudication in the form of pain in the limbs only on walking, and then there is relief of the patient symptoms on taking rest. This intermittent neurological claudication results into persistent pain even on sitting for most of the patients in the advanced stages, because there is constant compression over the nerve root by the disc in the spine. So these patients need to consult a neurologist and they undergo a imaging of the brain, imaging of the spine with the MRI, and get to diagnose the intensity and severity of the problem. After diagnosing the degree of the disc prolapse and the intensity of the problem, the patient is to be treated with neurological medicines for long-term therapy and symptomatically monitored for the relief of the symptoms. If the symptoms are medically managed, he needs to be on constant supervision under the neurologist's care. And if the symptoms are aggravating or there is a progression of the symptoms in the form of development of motor weakness of the limbs, patient needs to be consulting a neurologist surgeon for the further to halt the further progression of the disease. So I request you all to consult your neurologist for the low backache problems. Thank you.